Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Learning. I'm chatting today with Dixie Whetsell about her upcoming presentation for Gold Perinatal 2016 titled Antibiotics and Breastfeeding, Indications and Impact for the Dyad. So Dixie, thank you so much for being with us today.
Well, thank you for inviting me to do this presentation.
Well, we are very excited to have you with us. Now, before we start chatting about your presentation, perhaps you can tell our delegates a little bit about yourself and your professional journey.
Well, I am one of those lactation consultants that came from another background. I was working in the public health field as a community health educator, doing lots of different kinds of health education, and part of that was breastfeeding education. And after doing some breastfeeding education and having my own breastfeeding experience with my daughter, and then realizing the lack of support that we were providing at my county health department, I asked to get more training and was fortunate enough to have support from my employer to become trained. Worked in public health then in a county health department and WIC program until I went into private practice and did that, home visits for about 10 years, and then transitioned to working in a hospital. And now I'm working in a high-risk maternity center, Legacy Emmanuel, and we also have a children's hospital next door, so I get to see moms and babies in both of those facilities.
That's fantastic. So perhaps you can tell us a little bit about your presentation topic. You're going to be talking about antibiotics and breastfeeding, and I'm curious how this became kind of an area of interest for you.
Well, that is that is a very good question. Because of my work setting right now, where I work with a lot of high-risk maternal situations, I noticed when I was taking histories on mothers that so many of them were being treated with antibiotics. I also get to work in the children's hospital and as well as just working with postpartum families. And again, was looking at how many of those infants were being treated with antibiotics. And it became a question for me. Are we overusing antibiotics? What role do antibiotics play? Because I certainly was also reading the literature about the effects that antibiotics can have short and long term. And certainly in my work, I was seeing the impact that it could have, although I realized also the value of it. So it became a little rabbit hole that I dived down into to answer those questions for myself.
Hmm. That's great. And it sounds like it must be really interesting for you in your work situation because you're working with postpartum families, but also at the Children's Hospital, and you are seeing kind of a range of ages. That must make it really interesting to see
It's
the different stages.
Yes, it's a very rich practice environment. And
Mhm.
yeah, so it gives you the opportunity to ask some of these clinical questions and to get to work with other people who are asking some of the same clinical questions. So that's the information that I'm going to be presenting today is the broader picture, but then looking at some very specific examples then of how antibiotics are used in that high-risk maternal setting and how antibiotics are used in the pediatric setting as well.
Okay, interesting. Now, do you feel like antibiotics are being overused in the perinatal period, or do you think that, in your practice setting, said that you are seeing a lot of antibiotic use. So do you think it's being overused, or is it just the fact that you're working in a high risk setting and those antibiotics are truly needed?
Well, I think both of those things are true currently, and I think that's because we're still understanding how to best refine the use of antibiotics. So I think the other thing in this topic area that's so interesting is that issue of antibiotic resistance. So our practice has to change over time in response to the changes in how effective different antibiotics are for different conditions. And so I think that's another piece of it that makes it a really challenging area for practice protocols to be up to date compared to what we're learning as far as resistance and what's going on with resistance. So we're kind of chasing our tail a little bit, and I think that's the part that that's the part where I was looking at, are we overusing certain antibiotics because they're not as effective, but yet we have these protocols in place because we know that they are effective in treating some of these conditions. Yeah, so I think that's a question we should all be asking ourselves. Are antibiotics being overused in our particular practice setting? Yeah.
Absolutely. And I like what you said there about, refining our understanding. I like that. So thank
Yeah.
you.
hmm
So just as we come to the end of our little interview here, what do you hope delegates will be able to take away from your presentation and kind of take back with them to their own practices?
Well, I think that one of the things I want to do is increase awareness about this issue. As I said, my awareness came from just reading histories over and over again, and then walking into a room and seeing the impact of a mother being treated with antibiotics or a baby being treated with antibiotics. So I hope to increase people's awareness. Many lactation consultants don't work in a practice setting where they see those impacts right away. So I want to really increase awareness among folks. And then I also want folks to be aware of what's going on internationally related to antibiotic resistance and what we call antibiotic stewardship efforts. So there are some things that can be done to, again, refine the use of antibiotics, to tailor the use of antibiotics, and also to reduce the need for antibiotics. So I'm hoping that delegates will take away information about all of those options.
Okay, well, Dixie, it sounds fascinating, and I know I'm really looking forward to your presentation. I'm sure our delegates are as well. So thank you so much for chatting with us today.
Oh, thank you. And I'm looking forward to it too.
Okay, thank you so much. And for our delegates who are listening, you'll be able to hear more from Dixie on Tuesday, October 18th at 2100 UTC. Be sure to check out our website at goldperinatal.com for all of the details. So thank you so much, everyone, for joining, and have a wonderful day.